Imagine waking up with a headache so violent you can't see straight. There is no hospital nearby, no pharmacy, no pill that will make it stop. You lived 10,000 years ago, and the only thing standing between you and unbearable pain is a sharpened piece of stone, a fire, and someone who has done this before. So they pick up the stone, and they cut a hole in your skull while you're still alive. This sounds like the beginning of a nightmare, but it's not fiction. It's called trepanation, and it is the oldest surgical procedure ever discovered. Archaeologists have found evidence of it on every inhabited continent: Europe, Russia, China, the Americas. More than 1,500 skulls from the Neolithic period alone show this exact operation, deliberately performed thousands of years before anyone understood what bacteria was, or why infections happened, or how the human brain actually worked. And here's the part that should genuinely stop you. They were often successful. For a long time, modern scientists refused to believe this. In 1865, an American archaeologist named Ephraim George Squire brought a trepanned skull from Peru to the New York Academy of Medicine. The skull had a large, clean hole carved into the top. The room full of doctors looked at it, and they didn't believe what they were seeing. Because in their own hospitals, in the 1860s, cutting open someone's skull was almost always a death sentence. Survival rates barely touched 10%. Infection killed nearly everyone who survived the surgery itself. So how could ancient people, using nothing but sharpened stone, somehow be surviving the exact same operation? The answer, when it finally came, was almost insulting to modern medicine. They were surviving it better. Researchers studying skulls from the Inca Empire found survival rates between 75 and 83%. Compare that to the American Civil War, fought 400 years later, with metal instruments and a basic understanding of anatomy. Cranial surgery during that war killed between 46 and 56% of patients. Soldiers operated on by trained 19th century surgeons using steel tools were dying at more than double the rate of people treated centuries earlier with stone. How is that even possible? The answer lives in the bone itself. When archaeologists examine a trepanned skull, they look for one specific detail: new bone growth around the edge of the hole. If the edges are sharp and raw, the person died during the procedure, or soon after. But if the bone has started to smooth over, if you can see new tissue beginning to grow back across the opening, that means something extraordinary. That person lived. Not just for a few days, for months, sometimes for years. One skull, discovered in Siberia and dated to roughly 7,000 years ago, showed something that stunned the researchers who examined it. The bone hadn't just healed at the edges. It had grown back so significantly that the man who underwent this surgery must have survived for years afterward, walking around with a section of his own skull regrown, generations before anyone would write down the word anatomy. So why were they doing this in the first place? The evidence suggests two very different reasons, and they tell us two very different stories about what it meant to be human long before we had a word for medicine. The first reason was brutally practical. Head injuries were common and deadly. A blow from a club, a fall onto rock, a fractured skull pressing down on a swelling brain. Today, we know that pressure inside the skull after a head injury can kill you just as easily as the injury itself. Modern neurosurgeons still relieve that exact pressure with modern tools in modern operating rooms. Somehow, without microscopes, without anatomy textbooks, without any of it, ancient healers had already figured this out. They knew that opening the skull could relieve pressure. They knew that removing broken bone fragments could save a life that would otherwise be lost. This wasn't superstition. This was observation, repeated over countless generations, refined by trial and error into something that worked. But the second reason is the one that stays with you. Some of the trepanned skulls show no sign of any injury at all. No fracture, no trauma, nothing that explains in purely physical terms why someone would cut into a perfectly intact skull. Anthropologists believe these cases were different. They believe some of this was performed on people suffering from seizures, from violent migraines, from conditions we would now call epilepsy, or severe depression, or psychosis. Conditions that, to people without any concept of neurology, looked exactly like something foreign had entered the body, something that needed a way out. So they gave it one. A small hole, carved with painstaking care into the side or top of the skull, believed by some communities to release whatever spirit, whatever pressure, whatever invisible thing was causing the suffering inside. We will never know if it worked in the way they hoped it would, but we know with total certainty that many of the people who underwent it walked away afterward, alive, healed at the bone, carrying a hole in their head for the rest of their life as proof that someone had tried. And this wasn't reckless, panicked surgery. The placement on these skulls is remarkably consistent. Ancient practitioners avoided major blood vessels. They avoided regions of the skull most likely to cause fatal bleeding. They appear to have understood, through nothing but observation passed down across generations, which parts of the head were dangerous to touch and which were not. This knowledge had no textbooks, no universities, no written records to pass it forward. It lived entirely in memory, in hands, in the people who had watched it done before, who had seen what worked and what didn't, who carried that knowledge forward the only way they could, by teaching it to the next person who would need to use it. Trepanation wasn't the only thing they had. Long before anyone understood bacteria, prehistoric people were already using natural antibiotics without knowing the word for it. They applied certain molds to wounds. They used specific clays packed directly onto cuts and infections, the same clays that some animals instinctively eat or roll in when they are sick. They were watching the natural world and borrowing its solutions. They didn't know why moldy substances sometimes stopped infection from spreading. They didn't know why certain plants reduced fever or why certain barks eased pain. They simply noticed, tried again, remembered what worked, and passed it on. That is, in its most basic form, the entire foundation of medicine, long before anyone called it that. So here's where this leaves us. For most of human history, there were no hospitals, no anesthesia, no antibiotics in the way we understand them today, no certainty that any treatment would work. And yet, somehow, in caves and villages scattered across nearly every continent on Earth, completely unaware of each other's existence, ancient humans arrived at strikingly similar solutions to the same impossible problem. How do you heal a body when you don't yet understand what a body even is? The answer wasn't ignorance. It was observation, courage, and an extraordinary willingness to try something terrifying, simply because the alternative was watching someone you loved suffer and doing nothing at all. They didn't have medicine, not the way we define it now. What they had was something harder to measure, the will to keep trying, generation after generation, until something finally worked. And somewhere in that hole in the skull, healed and smooth after thousands of years, is proof that it sometimes did.